Sorry, I've lost
Hi,
the
Simon. Can
slide.
you hear me?
Yes, I can. I can hear you. Sorry, I've just lost my slide where it says what you will be focusing on, but I guess you can pick it from there. I'm guessing that it will be focused on the overall aspect of what we are looking at, the history of WASH in post-independence 50 years of Bangladesh. So can I just welcome you quickly to do your presentation? Thank you.
Sure. Thanks, Simon. So I'll take that as my cue to, I think, start the session with a provocative statement. And the question posed to me was the challenges and successes around reaching the hard to reach people when it comes to safe water. And in my 11 years of experience, I would like to start by saying that free water is the most expensive water. And so what I mean by that is, so I was originally born in Dallas in Texas, where I'm actually today. And my parents are Bangladeshi American. And so, sorry, my parents are Bangladeshi, I'm Bangladeshi American. And so coming to Bangladesh every summer was an eye-opening experience where I saw the differences between piped water in the US versus tube well water in rural Bangladesh. And so in 2004, I met with a professor, Dr. Roop Singh Gupta from Lehigh University, who invented a resin that can remove arsenic from groundwater. And that's actually one of the largest mass poisonings in human history, according to the World Health Organization, in Bangladesh, as well as in Eastern India. And so I studied public health. And in 2012, I met Dr. Singh Gupta as part of a Fulbright program. And we started talking about why safe water continues to elude the low-income populations, particularly in Bangladesh, in India, et cetera. And we agreed that it wasn't so much a technology problem as much as it was a management model problem. And so, Drinkwell, which is the company that I founded along with Dr. Singh Gupta and Mike, who's his PhD student in the center photo, we're effectively a company that's trying to eradicate the water crisis through technology, yes, but what we quickly realized is it's not an issue of just the purification technology, it's the service delivery modality itself. And so over the past 8 years, we've basically worked with about 41 partners. We've deployed about 540 systems ranging from a domestic filter to piped water schemes that are 93 meters cubed per hour. And what we've found is that there's very different operating models that really dictate how you can really reach the poorest of the poor. And I think, I'll speak to our Bangladesh experience today. And the model that followed was, first, we received some seed funding from USAID, and then we worked with the Department of Public Health Engineering in Bangladesh. And then we started to work directly with WASAs, initially Dhaka WASA in 2017, and then Chattogram WASA last year. And what we first found, I'll take you to Dhaka first, is in 2017, there's 700 water pump houses that WASA has. And water is supposed to be free at these pump houses for the 4 million low-income floaters who come to collect water. However, the reality was that you had a lot of water sharks kind of illegally occupy these pumps and jerry-rig lines to sell water of inconsistent prices, at inconsistent quality, and inconsistent times. And so we partnered with WASA to actually kind of professionalize the system and see if there was a way we could actually officially and legally set up a way for these low-income floaters to actually collect water from these ATM booths. And so that's effectively the start of how I realized that, yes, the water is in theory free, but it's actually expensive because people are actually either on the supply side taking advantage of a situation, or on the demand side, finding that neglect of the water infrastructure is so high that they're having to do additional purification or resort to other sources of water to meet their needs. And so the public-private partnership model we did with WASA was where we would provide the filtration technology, the water ATM at no cost to WASA. And in exchange, we would want WASA to allow us to operate on their premises. And so they set the tariff at 40 paisa per liter. And we work with them to set the timing of the ATM booth, to agree on water quality parameters. And then we also use different kinds of technologies to ensure minimal system loss. And basically, we have a 4-stage operating model. What we basically do is first we'll test the water. So arsenic is very prone in rural areas. In Dhaka, not so much, it's more iron. Same thing in Chittagong, you have higher iron and salinity in parts of Khulna. And once we understand the baseline, we'll do a public-private partnership contract directly with the government agency. And then we'll build the system. It'll be anywhere from 3 meters cubed to, we've done 6 large pipe water schemes in West Bengal. And then we'll lean on the government entity to really set the tariff, which is extremely important, just to ensure equity. And then once the tariff is set by the government agency, we will do the operation maintenance ourselves. And then what's critical is we don't expect the maintenance and operation costs to be recovered through just the tariffs. So we do expect some subsidy from the government, because tariff is naturally the biggest question when it comes to equity and really accessing the poorest of the poor and helping them afford safe water. So if I just give you kind of a 3-year snapshot, we've basically grown around 5x around our deployments, a little over 540 systems serving 18.5 million liters per month, 6.4 lakh people covered. But what I'm most proud of is that we've created 330 local jobs. And as the previous panelist mentioned, I think when it comes to O&M, local job creation is of utmost importance. And we have around 20% of our ATM booth operators as females. And I think that's really critical to ensure proper community sensitization of what a water ATM is and ensuring that you have proper buy-in from the local community. Now, I think what COVID-19 brought about is more involvement of the larger companies to engage in WASH. So Happy Tap, who spoke before me, had a hand washing station, and we actually partnered with them and deployed these hand washing stations across the ATM booths around March and April of last year. And then as it was clear that the COVID variant was evolving into the Delta variant, we deployed 250 hand washing stations at no cost to the end users across Dhaka in partnership with Dhaka Wasa and Unilever. And I think as we think about, there were questions about lowering budget priorities fiscally from the government when it comes to WASH. Clearly, there seems to be a mandate and I think a business case for Unilever Bangladesh to promote Lifebuoy by subsidizing the cost of these hand washing stations, which typically go defunct. But in our case, we have a 24-month contract with Dhaka Wasa, with Lifebuoy, to ensure that if the pump stops working, if the water runs out, if the soap runs out, that it's properly refilled. And the business case for that is you're actually entering the mindset of these low-income customers. And as their incomes improve, hopefully you can get more of their mind share and get them to finally afford other products. But coming back to the crux of the question, I think, when it comes to free water being the most expensive water, I think the natural inclination, at least I had when I first started, was water should be free. It's a human right. Everyone deserves to have safe water. And in Assam, we've actually deployed 179 systems earlier this year where the water is completely free. And it's a 24-month operation maintenance contract we have with the Public Health Engineering Department. It's an arsenic iron removal system. However, what happened was there was an election and we were very nervous because now, thankfully, the ruling party remained in power. The chief minister, however, did change. And what that meant was if for any reason, A, the political party changed, or B, there's still a level of uncertainty with the new chief minister. If there's a lack of political will to re-up the O&M contract for these 179 arsenic iron removal plants, then all of these people who live in these hard to reach areas who are habituated to access safe water for free will no longer have access. And so there's a real question of continuity. And I think that's the issue at hand. When we work in Wasa with Dhaka and Chattogram, there's a clear tariff. And so even if you have changing winds politically, there's at least a willingness to pay that will shield kind of this low-income population from political economy and political interference. I think that's the real challenge, I think, when we look at the next 50 years. how can we maybe cluster together different management models so that the economics make sense, to where maybe you have some areas be free and other areas be where you charge a tariff, so where you can sustainably manage water access without being so sensitive to political winds. So that's kind of the lasting thought I wanted to leave with you. Thanks, and I'll look forward to the questions.
Thank you very much, Minhas Chowdhury, the CEO of Drinkwell, for your presentation. It was really, really good to see. You mentioned safe water will be one of the expensive one. That is really, really striking comment statement to start with, and that is very, very important. I once heard that if there was a third world war, that would be on water or clean water. So that's quite interesting to get the scenario of how important water is to human life. Thank you for your presentation. And like we said, we